The Valley Medical Center in San Jose is one of the few select clinics working with Berkeley Bionics to test out eLEGS technology. Spinal cord injury patients at the rehab center are training with the help of physical therapists to learn how to walk again. Karen has been using eLEGS for more than 10 sessions now, and for her, the chance to walk out with a pair can't come soon enough.
So Karen, I'm wondering if you can tell me a little bit about your experience with eLEGS and also how long ago you sustained your injury.
So I was in a plane crash. I was the pilot in September 2009, and I just feel so blessed to be able to be in eLEGS. I feel like I'm walking like I walked before. It's just such a great experience. I really feel like it's helping the connection. So long term, the brain is getting all the way down to the legs, learning to walk. And I wish I could take it home with me. I keep teasing I'm going to walk out of here with the machine because I love it so much. It's so rewarding to me to be able to use it.
And how do you feel that it kind of integrates and how seamless is the process?
Especially once I figured out how to walk normal, thanks to the great PTs, it's integrated completely. I don't feel the weight because I'm moving forward and making my legs move. Follows the normal walking pattern that you would walk. And so for me, that's just so rewarding.
With the success of the eLEGS trials so far, doctors at Valley Medical are confident that they're just scratching the surface of eLEGS potential. Dr. Akshat Shah, Chief of Spinal Cord and Orthopedic Rehabilitation, looks forward to a day when an injured patient will no longer have to leave the hospital in a wheelchair.
What do you see as the future for eLEGS? What is kind of the length of treatment here, and how are patients reacting to this? How's it helping them?
Historically, most people who have spinal cord injuries have traumatic, life-altering tragedies. And what happens is, more often than not, they leave in a wheelchair. I think ultimately what we want is to be able to say, okay, you're not leaving in a wheelchair, you're going to leave walking out here. And here's a device we can give you that basically kind of kicks the wheelchair to the curb. You wake up in the morning, instead of not being able to get out of your bed, you slap on a pair of legs, walk to the kitchen, make yourself some breakfast, walk out to the car, drive to work, and you're back to your life as you know it. That's the ultimate vision, you know, and the more that we can do to get people there is the key. I think most people and most patients want hope. And lastly, in these kind of situations, when you're lying in a hospital bed in an ICU and a doctor comes in and you know in your heart that what you're really afraid of them is saying you're never going to walk again, you're never going to move your legs. And in that moment, it's full of despair. I think if you as a doctor can provide an ounce of hope and say, okay, I know this is hard, I know it's difficult, but I have something that can help you. I have something that can provide you hope. You see people's face light up, and you see them holding on. That really allows them to get through back to their life.
What's next in store for these bionic devices? The VMC Foundation is dedicated to raising awareness and funds for the project, hoping to make room for more technology like eLEGS.
Our job really is to tell the world we want to raise some funds to support the clinical work and be ready for what comes next, because eLEGS is one bit of technology, but there may be others down the road. There may be things controlled by brain activity. There may be things controlling arms if you don't have arm function. We want to make sure we're ready, both fiscally ready and also for the community to come together and support the work we're doing. That's really the role of the VMC Foundation. We used to think of ourselves as just fundraisers, but really we're now really about raising awareness. We're about raising morale.
And how has the fundraising been going?
It's slow, you know, it's a bad economy, but there are a lot of people looking at us saying, how can we help you get to the next level? So we've raised, many thousands now. Quite frankly, when you look at what's possible here, especially since we're moving into a new rehab center and our new hospital in the next couple of years, we're going to want to raise millions of dollars to do this kind of research and to provide the kind of technological advances, ultimately so that the patients benefit, so that patients can walk out of here instead of being in a wheelchair.